Thank you. Thank you, Mr. Chair and colleagues and staff. I'm pleased to be the author of AB 1568 along with Speaker Emeritus Atkins, which of course embodies the terms and conditions of the new 5-year Medi-Cal waiver. And I just want to thank the administration for engaging in some very difficult negotiations which in my opinion were incredibly successful and innovative and have brought to California some very exciting programs which have all just been discussed. And I think that this waiver really secures our state's position as a national leader in the delivery of high-quality, affordable health care to all of our residents. And I want to thank the department for giving us a thorough overview of Medi-Cal 2020, and I also want to thank the representatives of the public and district hospitals and CSAC for explaining how the waiver impacts them and the patients that they serve. As has been stated, AB 1568 enacts the Medi-Cal 2020 waiver, 5 years, $6.2 billion. It has the 4 core pillars which have been discussed, which emphasize serving our patients in the best location in the health delivery system, in outpatient settings and with primary care when possible instead of through the emergency department. We have the pay-for-performance model, which really incentivizes better health outcomes and access to care. We have the whole person care program, which will help us improve our coordination, which is much needed in the healthcare system. And then finally, we have the dental transformation initiative, which will help improve oral health care for our most vulnerable children. So collectively, I think the 4 pillars create a very strong proposal and puts us on the cutting edge of delivery of critical healthcare services in innovative ways in the state of California. And with that, I respectfully ask for your aye vote, and happy to answer any questions that you may have.
Great, thank you. First of all, we have a couple of people going to testify, or who've asked to testify. We're going to give them each a couple of minutes, with your indulgence, Mr. Bonta. First one is going to be, if you actually just come to the microphone, that would be great. Elizabeth Landsberg from Western Center, and then Brianna Pittman from the California Dental Association.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, and we want to add to the congratulations of Ms. Cantwell, folks at the department and the hospitals and counties on negotiating a very successful waiver, which we know was not always easy. We are in strong support of all 5 components of the waiver, the 4 that Ms. Cantwell mentioned, as well as the assessment. The analysis of the bill does have a summary of a couple of things we're hoping to strengthen in the bill, and we appreciate the inclusion of those. So a couple of those to call attention to. Under the whole person care pilot, there are a number of strategies that have been outlined that are required in the bill, and then the housing supportive services that several of the speakers have called our attention to is a permissive piece. And we really hope that given the health concerns of our folks who are homeless and at risk of homelessness, that will be a required component. We've seen very strong evidence about the housing support pieces and the impact that can have on health outcomes, and do hope that will be a required component. We're also supportive of Assemblymember Chu's bill that will sort of take the last step. We think the state was right in asking the federal government to use Medicaid dollars to fund the actual rental subsidies, and appreciate that Mr. Chu's bill seeks to finish the job there. In terms of the assessment of access in Medi-Cal managed care plans, we're particularly concerned about access in rural communities. We have applied to participate in that stakeholder process, but do hope that there will be a specific look at rural communities and the need that sometimes people have to travel extensive distance to get to specialty care in particular. We also appreciate the policy issue raised in the analysis about access to the University of California hospitals for Medi-Cal members. We work with legal aid offices in all of the 58 counties, and we do hear significant concerns about Medi-Cal beneficiaries not being able to access particularly specialty services. And we look forward to having conversations about this, but we'd like to explore the possibility that the UCs be required to try to have contracts with all the Medi-Cal managed care plans and not just one of the plans in the county. Thank you.
Thank you very much.
Good afternoon, Chair and members. Brianna Pittman with the California Dental Association. We are also very excited to see the inclusion of dental care in the Medi-Cal 2020 waiver for the first time, and appreciate Ms. Cantwell's comments about making sure that these incentives go towards to the providers and making sure that we actually do see the increases in utilization and access that we know we need and that are set out as the goal in the waiver. So we are working and look forward to continuing to work with the department and stakeholders on those pieces and are very supportive and urge our vote.
Great. Others in support?
Greg Herner on behalf of Alameda Health System. We provided one of the examples in Prime that Sarah brought up, so this is a very important bill to implement, and we thank our representative for Alameda Health System for carrying this bill.
Thank you.
Mr. Chair and members, goes without saying, Terry Thomas on behalf of the California Association of Public Hospitals and Health Systems in strong support of the bill.
Thank you.
Michael Radigan on behalf of the Board of Supervisors, Santa Clara County, in support.
Thank you.
Mike Montgomery, Congress of California Seniors, support the bill.
Thank you.
Nicole Wertelman on behalf of San Bernardino County and Ventura County in support.
Thank you.
Barbara Glazer with the California Hospital Association in strong support.
Thank you.
Michelle Cabrera with SEIU California, also in strong support.
Thanks.
Grace Childs with the Urban Counties of California in support.
Thank you.
Beth Capel on behalf of Health Access California in support.
Thank you.
Noah Paramo representing California Rural Legal Assistance Foundation in support.
Thank you very much.
I have two other clients in support. Can I add them to the record?
Of course.
The Association of California Healthcare Districts and the County Health Executives Association of California are both in support.
Great, thank you. Anyone in opposition? Anybody in between? Okay, we don't have a quorum, but I'm going to bring back for questions because I suspect there are questions from members here. So, Ms. Waldron?
There's a lot in this bill, and it's a great bill, by the way. So it's awesome when you have no opposition to. I'm excited about a lot of it. A few of my hospitals benefit. You know, I'm really excited about the whole person care aspect. The dental is really a big deal in my district. There's one part where you have to go 50 miles to even find a dental provider. I did have a question. I was just curious, because there's so many acronyms, I'm just trying to wrap my mind around them. For the funding for the dental portion, it says it's generated from designated state health programs. If you could just describe that, is it from savings in that? Or, okay,
sure.
Thank you.
Yeah, I left out that piece. I apologize. I was trying to stick to my 25 minutes. So in prior waivers, the state has received essentially just general fund savings by being able to claim federal funds for programs that had previously been 100% state funded. So in the prior waivers, that funding just became general fund savings, sort of wasn't used to reinvest in anything in particular. As we came to this waiver, there was, a deep interest on our part to make sure that, because we wanted to have something like dental in the program, that we needed to find a way to fund it. And there was interest on the part of CMS. They're not a big fan of the designated state health programs and the way that states have used them. And so the agreement was, we'll still be able to claim that money, so claim some federal funding for these state-only programs, but the general fund savings that you get from that by replacing some of the general fund with federal funds, you need to take that and reinvest it in order to draw down the dental program funding. So we are permitted to continue the use of these designated state health programs, but only to the extent to fund the dental program. So that's how we get to the total funds of $750 million for the dental program. Sure.
Other questions? I guess it's just going to be me then, because I have a few. Well, first of all, thank you very much for the presentation. Mr. Bonta, thank you for your work on this. I know this has been a really, really big job, and I think it's a great bill with a lot of really great components and very proactive in so many ways. So I have a couple questions. I want to first of all looking at the whole person care. You mentioned that applications are now, the application deadlines are pushed out. I know the application deadline was May 15th. Now we're looking at fall. So is that correct?
So if we get CMS approval for the pieces that we're looking for, the applications would be due July 1st.
July 1st, okay.
Yes.
And now, obviously, we know the application isn't ready yet, and we're not quite there yet. But what kind of interest are you getting from agencies and hospitals and entities?
Sure, a lot.
Okay.
We're getting lots of questions. That's why our FAQ document, I think, is like 12 pages already. We did do this non-binding letter of interest to try to help inform some of the structures. I don't remember off the top of my head. I think we got somewhere in the neighborhood of 20 letters from big urban counties like Los Angeles with public hospitals to some of the smaller rural counties as well. And so you didn't have to submit that in order to apply later, but we are getting broad interest from sort of across the spectrum of the state. We're hoping that we'll be able to release the actual application in next month in mid-May, and then there's 45 days for them to complete the application from there.
Okay. So we're looking at about $300 million in this, is that correct?
That's correct.
Okay. So, I was listening to some of the descriptions of potential projects. I know some of those things have been, other entities have been doing some of these things around hospitals. I know that I remember hearing about one hospital in Southern California at one point was actually having nurses go out to homes to help people with medications and so on and so forth. Those are obviously ongoing projects, but would a program like this allow for somebody who's been trying to get that off the ground to be able to expand upon that and make it into a bona fide project? Or would they be disqualified from that because they're already trying to do something like that?
No, absolutely. Our hope is that these are things that people may have started on smaller scales, and that this could help support to build some of that key infrastructure, which is often some of the hardest pieces to get, including like the data sharing and the IT infrastructure. So absolutely, that would be welcome, and to build on it and use that and be able to get some funding that they weren't able to get previously.
And that kind of led me to, you mentioned infrastructure. So by infrastructure, some of that is IT. What other kinds of infrastructure are you talking about? Because
it's been a topic of interesting conversation, so that's why everyone up here is laughing about it. We want to be as supportive as we can from a reasonable perspective and what we think CMS would allow. So there are things like, do you need to hire more people? So people as infrastructure. We think that could be allowed under this. So you say you're going to hire 2 case managers, you can get funding related to that. The more challenging piece relates to capital infrastructure, actual like bricks and mortar buildings. What we have said is that to the degree the cost of infrastructure, just like it is for a hospital or a clinic, always built into the cost of the service, right? Sort of, you stay in a hospital, some of that price includes the fact that you're in a building. Right. So to the degree, that's how it's included, but we certainly don't view this as you need $20 million to build a clinic, you can get $20 million from this program. That would be beyond the scope, but some type of support for the cost of that in the overall costs.
Great, thank you. Kind of transitioning to the Dental Transformation Initiative, you might guess I might have a little interest in that. You talked about increased participation among existing providers. Is there some component of the project to actually attract new providers? Yes. Because that's the critical need right now. We've got to maintain the ones we have, and it's really great to have an incentive for those to participate at a higher level, but we need providers, period. Yes. So can you explain how that might work?
Sure. So in each of these programs, new providers would also be able to get incentive payments. What we're still working through with the small stakeholder group that you heard Ms. Pittman describe. So how do we set the benchmark for a new provider? So if they had 0, right, 2% of 0 is still 0. So we're still working through how do we set some base level of services before an incentive payment kicks in. But absolutely our goal is to both increase utilization for those who are currently participating, but certainly want to see that this helps people get over the hump of wanting to participate because of some additional funding that's available to them.
So you have some sort of an outreach plan? Because I'm not sure people are really aware this is coming. So we're working with our dental FI and again the California Dental Association and others to figure out how do we do outreach to not only beneficiaries to know some of the services that are going to be available to them, but also outreach to providers both who are currently in the program, but also to the broader dental provider community to hopefully help them understand how to get into the dental program. Hopefully we'll have some easier ways to become a dental provider in Medi-Cal that obviously we're working on. But yes, absolutely that is part of the plan, and we're working with those stakeholders
stakeholders to figure out the best way to do that.
Okay. You mentioned that Prime is capturing, or somebody mentioned Prime's capturing, and it may have been you. Prime capturing information on how we're doing. In other words, assessments of ongoing assessments and data analysis as part of the ongoing project. We have an oral health director now of the state, and one of the big challenges around that is the assessing the need for treatment because we lack the raw data on some of that. So have you identified a role and any sort of funding for the oral health director, and how would that integrate with the dental transformation initiative?
Sure. So he is a part of our work group in terms of developing how this is all going to work. So absolutely are engaging him at sort of every level to help inform that work. There's not direct funding for that. All of the funding in the waiver is specifically to go out to providers themselves. But we are also looking for external entities who might want to support some additional work in terms of outreach and other things like that.
So does that include collection of data? Because I know that's the critical.
Yeah. So all of these programs will require data submissions from. It's really in our data, in some ways in our data already, but better ways for us to extract it. So we'll be doing, in some cases, it's semi-annual looks at data. For like the first domain, we'll be looking at, twice a year. Some of it's, you have to wait a whole year to see some of that. But yes, absolutely part of the work that our staff is doing and the work that, the team that we have a budget proposal for additional positions related to this waiver in order to support the additional data analytics we're going to need to do to both be able to run these programs but also evaluate their effectiveness.
Very good. Okay. Thank you very much. Anybody else? I know I have some closing remarks here before we move on. We still don't have a quorum yet. No, we're inching closer. It's somewhat of a normal issue here. But first of all, thank you again, Assemblymember Bonta and Assemblymember Speaker Emeritus. If you're out there somewhere, thank you very much for your work on the bill and the implementation of the Medi-Cal 2020 waiver. This 5-year waiver has significant aspects. Throughout the waiver, we are testing new payment methodologies for our public hospital systems and seeking to transform healthcare policy by increasing the integration of healthcare services while improving the quality of care provided to Medi-Cal and uninsured Californians. I personally have 4 district hospitals in my district, so I'm glad that they're participating in Prime. Personal interest here, obviously, and I appreciate that the department is working with them. Studies have shown that individuals experiencing homelessness are more likely to access costly health care services. So the housing component, I'm really, really excited about that. And it's obviously a huge focus for our caucus this year around homelessness and housing. And so I think that all of this dovetails nicely. And it's not just a yearly thing. We're going to be working on this for years to come. I really also applaud the whole care component of the waiver that tackles the really hard policy challenges that go along with that. I tend to be this way anyway, but a little cautiously optimistic about the dental transformation initiative. But I'm hopeful that we're going to see progress there. It actually represents the single largest investment in our state dental program in a decade, and that is significant. So I know that, and having practiced dentistry, the impact of good dental hygiene, oral health, the experiences of the quality of life and their self-esteem are really important to their being successful in the workplace and in school. We also know that half of the eligible beneficiaries do not receive dental care that are eligible for, and the bottom line that the system isn't working well. It's broken. So by focusing on early care and prevention, improving continuity of care, we can make significant steps to make sure that Californians are receiving the oral health care they need and they deserve. With this significant investment in funding in the combination with efforts to improve how providers enroll and interact with the system, I hope to see a significant improvement in the administration of the Denti-Cal program. Lastly, I'm also very optimistic that the monitoring under each domain and the evaluations will provide us with the direction on how to further improve beneficiary services going forward and increase provider participation in the Denti-Cal program. So at some point when we have a quorum, we will call for a vote on your bill. And
can I move the bill?
You can't move it until we have a quorum. So would you like to close, Mr. Bonta?
Yes, thank you, Mr. Chair. I just want to thank you for your thoughtful questions and other members' thoughtful questions and your supportive comments. I want to thank your staff for an outstanding analysis on the bill. And this waiver will really improve the quality and value of care provided to the most vulnerable Californians. Looks like you might have
hold for a moment. Madam Secretary, could you take the roll, please?
Thank
Wood?
you.
Here.
Mainshine, Bonilla, Burke, Campos, Chu, Gomez, Hernandez, Lackey, Nazarian,
Present.
Olson, Patterson, Ridley Thomas, Rodriguez, Santiago, Steinnorth, Thurman, Waldron.
Move the bill.
Second.
Please,
Thank you.
please continue, Mr. Bonta.
With my thanks for your thoughtful consideration at this moment before it might slip away, I respectfully ask for your aye vote.
Thank you, Mr. Bonta. The motion has been made and seconded. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Wood,
Aye.
Wood, aye. Mainshine, Bonilla, Bonilla, aye. Burke, Campos, Chu, Gomez, Hernandez, Hernandez, aye. Lackey, Lackey, aye. Nazarian, Nazarian, aye. Olson, Patterson, Patterson, aye. Ridley Thomas, Rodriguez, Rodriguez, aye. Santiago, Santiago, aye. Steinnorth, Steinnorth, aye. Thurman, Thurman, aye. Waldron, Waldron, aye. Burke, aye.
Mr. Bonta, your bill is out 12-0. Thank you very much. Thank you to the panel for your participation and all of your hard work. Really appreciate that.
Thank you, Mr. Chair, colleagues, and staff.
Thank you. Senator Lara.
Move the bill.
Thank you, Mr. Chair and members. I'm pleased to present SB 10, which directs the state to apply for a federal waiver to allow undocumented Californians to buy insurance with their own money through Covered California. I want to thank the chair and the committee staff for hearing this important bill on short notice, and I am taking the amendments as committee amendments.
Thank you.
Thank you.
It's been seconded. It's been.
I love the assembly.
Senator. It only goes down here from down.
Mr. Chair, again, thank you for your support, and thank you to the legislature for acknowledging that we must do everything we can to ensure we cover all of our vulnerable Californians, including our undocumented community. Last year, we really made history ensuring that over 170,000 children across the state have access to health care. Again, we're taking another bite at the apple. We're not going to rest until we finally get health care for all. This is just one more step, so I respectfully ask for your aye vote.
Thank you, sir. At this point, yes, please, speakers. I'm out of whack here. We're doing things differently. So we're back to our normal routine. 2 speakers, 3 minutes apiece. Please go ahead. Thanks.
Yes, good afternoon, Mr. Chair and members. Thank you for allowing us to be here today. Ronald Coleman on behalf of the California Immigrant Policy Center here in support of SB 10. Today, our state's healthcare market is segregated based on immigration status, and SB 10 could bring down that discriminatory barrier that leaves undocumented Californians locked out of Covered California by simply directing our state to request a waiver from the federal government under Section 1332 of the ACA to allow undocumented immigrants to purchase coverage using their own resources. Our broken immigration system and divisive politics that are out of touch with California's reality have unfairly and discriminatorily and purposefully caused undocumented immigrants to be excluded by our Congress. California can't afford to wait on the federal government on this issue. 1 in 6 California children have an undocumented parent, and we can't allow individual health disparities to proliferate through those families. Take the story of Sylvia Espino. She is an individual resident that lives in the county of Marin. Unfortunately, she's not able to access health care coverage due to being above income eligibility limits. However, she has lived here for 17 years, married, 3 children, a number of grandchildren, and has anemia. She's been to the ER on a number of visits. Those health care costs have soared past $10,000, but she wants an opportunity to be able to purchase health coverage in the exchange while she's purchasing coverage for other family members so that they can also go to the same providers and get the same information all at the same time. This really is about breaking down the barriers to families like Sylvia's and ensuring that all Californians can access health coverage with all of their family members. We ask for your aye vote and thank you for your support. Thanks.
Thank you, sir.
Beth Capel on behalf of Health Access California. SB 10 is actually a fairly simple measure. It asks that Covered California apply to the federal government for a waiver of the requirement that it sell only qualified health plans by selling look-alike California qualified health plans so that every Californian may have access through Covered California. In today's insurance market, any individual can purchase coverage outside of Covered California, but if a family shows up and one member is not documented, they are unable to purchase coverage through Covered California. So it's a simple measure to allow people to spend their own money to buy health insurance. For that reason, we're in support. Thank you.
Thank you very much. Others in support, just your name and organization, please.
Kimberly Chen with the California Pan-Ethnic Health Network in strong support.
Thank you.
Michelle Cabrera with SEIU California, also in support.
Thank you.
Kelly Brooks with the County Welfare Directors Association, here in support.
Thanks.
Thank you, Mr. Chair. Members, Christopher Castrillo on behalf of Los Angeles Mayor Eric Garcetti and the California Faculty Association in support.
Thank you.
Joseph Villala on behalf of Chila, the Coalition for Humane Migrant Rights of Los Angeles.
Thank you.
Jasmine Gordon on behalf of the California Black Health Network in strong support.
Thank you.
Maria Paz with Ultimate Health Services in strong support.
Thank you.
Alvaro Huerta with the National Immigration Law Center in strong support.
Thank you.
Good afternoon, Mr. Chair and members. Santosh Siram Santana, representing the California Asian and Pacific Islander Budget Partnership, in strong support.
Thank you.
Brenda Diaz with California Coverage and Health Initiatives in strong support.
Thank you.
Judy Darnell with United Ways of California and representing 33 local United Ways in strong support.
Thank you.
Myra Alvarez on behalf of the Children's Partnership in strong support.
Thank you.
Elizabeth Landsberg, Western Center on Law and Poverty, in strong support.
Thank you.
Jeanette Saripatin on behalf of MALDEF, the Mexican American Legal Defense and Educational Fund, also in strong support.
Thank you.
Lynn Jewell on behalf of the Southeast Asia Resource Action Center and Asian Americans Advancing Justice California in strong support.
Thank you.
Nisette Shore on behalf of the Alliance for Catholic Healthcare in support.
Thank you.
Sarah Flox, California Labor Federation, strong support.
Thank you.
Gregory Kramer on behalf of Planned Parenthood Affiliates of California, representing 115 clinics in strong support.
Thank you.
Erica Cabato with the Green Lining Institute in strong support.
Thank you.
Noé Paramo, representing California Rural Legal Assistance Foundation, in strong support.
Thank you.
Katia Lopez with the Latino Coalition for Healthy California, and we are in strong support.
Thank you.
Mari Erlinson on behalf of the National Association of Social Workers of California, in strong support.
Thank you.
Chair and members, Sean South on behalf of the California Health Plus Advocates, representing California's community clinics and health centers, in support.
Thank you.
Juan Berdin with the Latino Coalition for California, in strong support.
Thank you. Anyone in opposition? Seeing no one, we'll bring it back for questions. Mr. Thurman.
Thank you, Mr. Chair. I actually just want to thank the author for bringing the measure. It was an honor to be a co-author of SB 4, and if it's appropriate, I would love to be a co-author on this measure. It just strikes me that all we're asking for is to allow someone who, pays taxes in their community and wants to buy health insurance with their own money to have the ability to do so. For all the public health benefits and the obvious that someone wants to buy health benefits, I can't imagine why we wouldn't support this. Thank you, and I look forward to seeing the passage in this committee today.
Thank you.
Thank you. Other questions? Comments? I guess it's back to me then. So, I'm sorry, Mr.
Thank you, Mr. Chair. Mr. Lahr, I want to thank you for bringing the bill forward. I know it's been a product of a great deal of work and long suffering by many who are going to be affected by it. I also want to highlight the work of the advocates because it's really taken a great deal, not just in healthcare reform, but in the further steps to make sure that we have access to quality health care. I know that the bill's been moved and seconded, and appreciate your leadership in shepherding this forward, Mr. Chairman. Thank you.
Thank you. So I guess back to me at this point. First of all, thank you so much, Senator Lar. Really appreciate that. I actually like to echo Mr. Thurman's comments, and I'd like to be added as a co-author if that's I'd be honored to be a co-author, quite frankly. And also we're adding an urgency clause. So
correct.
So okay, perfect. So thank you once again. Obviously, I'll make a couple comments here. I know you're working with Covered California on this, and I hope and I know that work will continue. And I know that we're going to be operational once this passed, based on the federal approval. So I hope that we can move our federal colleagues along on this and get this as soon as possible. I did a question. Can the state request a federal waiver upon enactment or wait until the implementation date? Do we have an answer? Does anybody know?
Beth Capella, on behalf of Health Access. Mr. Chair, if I may, upon enactment, we've clarified that with the federal government, correct?
Okay. All right, great. Well, thank you. Senator Lara, would you like to close?
Yes, thank you, Mr. Chair, members. Appreciate your support. And just to let the body know that over 30% of our undocumented immigrant population actually makes more than the federal guidelines to be able to qualify for Medi-Cal. And, we currently right now we're spending in limited scope Medi-Cal $1.3 billion annually. And these are folks that would, on a natural, qualify to be able to buy their own insurance. And so it makes economic sense. It's the right thing to do. We're very confident as we move, as we head out to D.C. next week. We're meeting with the administration, so we're very confident we're going to be able to get this done. And again, once again, make history in California as the first state to ask for this waiver in our nation. And it's our obligation not only to lead, but to also espouse our values, ensuring that no one's left out of our great society and the ability to pay for health care. So I respectfully ask for your aye vote.
Thank you, Mr. Senator Lara. Go ahead and ask the Secretary to call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Bonilla? Aye. Bonilla, aye. Burke? Aye. Burke, aye. Campos? Chu? Gomez? Hernandez? Aye. Hernandez, aye. Lackey?
Not voting.
Lackey not voting. Nazarian? Olson? Patterson? Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Aye. Rodriguez, aye. Santiago? Steinnorth? No. Steinnorth, no. Thurman? Aye. Thurman, aye. Waldron? Waldron not voting.
Chu, aye.
Chu? Chu, aye. Campos, aye.
Senator Lara, we have 9 votes. We still have some members missing. We need one more, so we'll leave this on call.
Thank you, Mr. Chair, members.
Thank you very much. With that, we will be calling members. We're going to leave the roll open for 5 minutes. We do need to have you come down and vote, please, wherever you are. In the meantime, we will. Well, there was no call on 1568, but we'll go ahead and open for additional votes.
Chu, aye. Ridley Thomas, aye. Campos, aye.
We're on 1568 for add-ons, Mr. Gomez.
Aye.
Gomez, aye.
So that stands at 16-0. We're going to, I'm sorry, hang on. We have to count now. 16-0. So we're going to lift the call and call the absent members on SB 10.
Mainshine? Gomez? Aye. Gomez, aye. Lackey? I'm sorry. Nazarian? Olson? Patterson? Ridley? That's it.
Makes it. So, Mr. Meach, I'm on SB 10. No, this Mr. Lara's bill.
On SB 10, Mainshine, not voting.
Okay, that vote now stands at 10-0. That measure is out. 10-1, excuse me. 10-1, that measure is out. So we will leave the roll open for 5 minutes for add-ons, but both measures are moving on. Due pass as amended. 1568 is due pass amended as to appropriations.
It's due pass to appropriations.
Due pass to appropriations. And then SB 10 is due pass as amended to appropriations.
Right.
So, okay, so we're just going to wait for a few more members to add on, but that will once we have members added on, that will essentially end our agenda for the day.
AB 1568, Mainshine, aye.